I'm Kathryn Schubert, and I'm President and CEO of the Society for Women's Health Research. My background is really in policy and advocacy, and so what I bring to SWHR is really continuing its historical momentum to use that science and translate it into policy change, making sure that we are building coalitions, bringing in patient group, research organization, and clinicians to really come together in that interdisciplinary way to make change. It's something that coming into this role almost 5 years ago, we really wanted to prioritize as an organization, and I think that we have done a really good job of that. I think also my role as a mother is really critical to bringing parts of myself to the job and really thinking about what is it that I need in support for my life, and how might that translate to others who are facing the same issues as they are building their professional careers, but also raising families and engaging in their life with their family, and making sure that everyone's health and well-being is prioritized in that way, so that it's not just a job, it is an integrated part of my life. As we think about women's health, it's really truly a passion. Coming into this role during COVID, when the office was shut down and public health was really critical, and women were bearing the burden of that, both from a caregiver perspective, but also from their own healthcare perspective, I think there have been a lot of advancements that we're really excited to see. And one of them being just the national conversation has completely changed in the last 5 years. We are not the only organization out there talking about women's health anymore, and we are really excited about that. We want as many partners in this fight as we can get. Part of our role in that has been to take what we're learning from our scientific interdisciplinary roundtables and our partnership with those organizations to create truly comprehensive and freely available materials for patients and clinicians in a variety of health focus areas. I would also say over the last 5 years, we've placed an emphasis on how to drive policy change and advocacy surrounding some of these issues. For the first time ever, we've had issue-focused policy agendas in bone health and heart health, which is still the #1 killer of women in this country. We have policy agendas in Alzheimer's disease. We've created advocacy toolkits on endometriosis and on heart health as well. And so I think we're really pulling all of these themes together in a way that is truly meaningful and going to make change. The launch of the Women's Health Dashboard was really exciting for us because for the first time we wanted to see what the data was telling us on the public health side. So we pulled data, and what we found was that Alzheimer's disease, breast cancer, COPD, mental health, and ischemic heart disease were really important issues for women's health, although not necessarily what we would have thought. And so pairing the data with calls to action in terms of how we can close the gap in these health outcomes through research was really important. So I think the dashboard is a really amazing accomplishment for us and something that we see as being really important for the future. The other piece, we are seeing a growth of funding for particular issues and conditions, but also just for women's health research broadly. We are seeing across the board funding for women's health within the National Institutes of Health, above and beyond what we've ever seen before. And so I think the growth is there, the progress is there, and it's all really exciting to see it come together in this way. You can't get anything done if you are not working in coalition and with partners to make success happen. And so the way that we address any challenges are to make sure that we're aligning with other organizations who are doing the good work, individuals on our working groups who are conducting the research and in the clinical practice setting every day, and importantly, the patients. They're really the key to all of this, really understanding what they're experiencing, what's important to them. Oftentimes what is important to a researcher is very different from what's important to a patient. And so how do we really dig into where we see those differences and how can we better align them is really critical to us. The society is always evolving. From 1990, when we were founded in a small room at the ACOG meeting by Dr. Florence Hazeltine and her colleagues, through building out our science programs to make sure that these conversations are happening, to the vast policy challenges that we're seeing now, we're always changing and remaining nimble to ensure that we're tackling the most pressing issues in women's health and research. And so I don't see that changing. I think as we see this conversation grow, as we see more friends in this space, to really make sure that we are taking a leadership role in using what we've learned over the past 35 years to truly advance and close the gender health gap. I'm really looking forward to seeing that, and I'm excited about what this next chapter looks like for us.